So thank you all so much for having me today. What an honor it is to share with you my dissertation topic. I'm very passionate about mental health and mental illness of our students, our community, and ourselves. What are we doing to take care of ourselves? So this is something that I have been a work in progress for a few years, and I'm happy to share with you the results today. So we'll get started. I'm going to talk to you about the effects of an online mindfulness program on depression, anxiety, stress, and coping among second-year undergraduate nursing students. Okay, the background and significance, why I felt that this was a good topic to look at, is the number of new nurses that we're going to need by 2030 is over 3.2 million. So what are we doing as nursing faculty to help our students stay in the program? And what is causing them to exit the program? So I found it is a very hot topic, mental health, in the literature, and it's something that's, like I say, near and dear to my heart. This is hindered by new nursing students getting into a program and not graduating. The last time that I looked, it's been since 2007, about 80% of nursing students graduate. What happens to the other 20%? Why are they not graduating? And a lot of them have said in the literature, it's because of depression, stress, anxiety, not being able to cope. And then of course we know how time-consuming nursing school is, so that might be life happened. So the purpose of this study, as I said a few times, was I was looking at an online mindfulness program, and I was reviewing, does it help with the anxiety, depression, stress, and coping? So I had to start by digging in the literature. What's out there? What's causing it? Nursing students reported that there are internal, external, and situational factors that cause them to drop out. Internal, from coming within, I can't do this. External, maybe not having support of their faculty, of their peers, or their family. And then situational. A lot reported, well, I really wanted to go to the basketball game, but I needed to be studying, or something to that effect. It just wasn't for them. So I wanted to see what I could do, hopefully within our program, to help these students as they continue through this journey. So what better thing than mindfulness? Mindfulness is free. Any of us can practice mindfulness at any given time. So mindfulness is just being present in a particular moment at a particular time. So there's apps on your phone. You might get the Breathe app. Take that minute to breathe. And I know most of the time we're like, no, I gotta do something else. I gotta go somewhere else, right? But really, literature has shown how much it helps. I looked, and there's face-to-face versus online. Of the 24 studies that I reviewed, all of them were face-to-face. So I thought, well, can we not put something online if we know how busy students are? What can we do to maybe make it a shorter module to teach them about mindfulness so that they would stay more engaged? That's what came up with 8 weeks versus 4 weeks. Most mindfulness studies, if not all, have been 8 weeks long. They take 26 hours to complete. I don't know about you, but nursing students don't have 26 hours to complete a mindfulness study. So I wanted to scale it back and see if a shorter mindfulness module could help nursing students. And would it continue to help them in the future? So some gaps in the literature is, of the studies, all of them were first-year nursing students. I can see why, because right when you get into nursing school, we want to teach them, right? We want to teach them how to cope. We want to teach them these strategies to help them be successful throughout. Something that I'm also seeing recently is the number of new grads who are only staying in the nursing field for about a year. So I would love in the future to maybe have a longitudinal study and see if that could help nursing students stay longer. So that was a gap in the literature that I saw. Let's see if a second-year nursing student has the same opportunities and it helps them just as it did the first year. Also, an online brief mindfulness program hadn't been evaluated in nursing students. So that was something that I was hoping that I could, even if it doesn't work, let's look at it and see. So the theoretical framework that I used was Lazarus and Folkman's transactional model of stress and coping. Very simple model here to follow. You can see that an event occurs and our primary appraisal is either, is it stressful or is it not? If it's not stressful, okay, great. Nothing to it, right? But if it is, we have to secondary approach that. So either we have coping abilities or we don't. That is where the mindfulness program came in to hopefully give them a positive coping ability when they are stressed. So my research hypothesis was nursing students' depression, anxiety, and stress scores would decrease, and their coping abilities would increase in the response to this online module. I had a lot of different research questions, so I'm going to try to put them together here. The first three were, after participating in an online mindfulness intervention, do second-year nursing students have decreased levels of depression, anxiety, and stress? And then three additional ones. Do second-year baccalaureate nursing students have increased levels or increased scores of positive coping abilities after participating in this intervention? Did they have decreased levels of negative coping abilities? And then I added, how do second-year baccalaureate nursing students perceive the impact of mindfulness? Did they feel it was worth their time, or was it an assignment I had to do and wash their hands from it? So the research design was a quantitative design, a pre-test, post-test, quasi-experimental one group. It was one group as it was an assignment in their course. It had a mindfulness intervention, and we added 2 open-ended questions to the post-test. The setting was a multi-campus health science center, University School of Nursing. The sample was a convenience sample at the university, and it was all second year or in their last semester. When I say second year, last semester nursing students enrolled in a transition course. The total number of participants was 76 students agreed to participate or allow me to utilize their data. And you can see the demographics there. The mean age was 22. And what I found interesting was 43% said they practiced mindfulness before I even introduced the module. So that number to me was, wow, I was not expecting that, but made me happy. So the instruments that I used, first I gathered the demographic data that you saw on the previous screen. The Depression, Anxiety, and Stress Scale, or the DASS-21, excellent scale. It's very reliable. It has 3 different subcategories. Depression, it asks about 4 questions about it, anxiety, and stress. The lower the score, the better. So keep that in mind as we're moving forward. And then I use the Coping Strategy Inventory short form. This has 4 subcategories. The 4 subcategories on this are problem-focused engagement, problem-focused disengagement, emotional-focused engagement, and emotional-focused disengagement. So that's a mouthful, but you'll see those in just a minute when you see the results. On that one, the higher the score, the better. So you can see how the lower, the higher. We'll discuss that in just a moment. So you're probably wondering, well, what is the intervention? How did she do it? So we have therapy assistance online, or TAO. TAO is free for all of our students and it's purchased by our counseling center. It was developed in 2012 from Dr. Susan Benton because she wanted to work with big need mental health disparities. So within this program, students don't have to wait 6 to 9 weeks to go talk to someone in a counseling center, which is probably what you're going to find in the literature, how long it's taking a nursing student or anyone to be able to go see a counselor. They can click, sign up, and do modules that she has developed as a counselor for students, faculty, staff, anyone. It's an excellent program. What I utilized was the 12 mindfulness exercises within this program. So these exercises range from 3 minutes to 12 minutes each, and there was 12 of them. And I did it over a 4-week period. So students had to do 3 a week for 4 weeks. So their time wasn't a whole lot, maybe 9 minutes one week and 30 minutes the next week, but they weren't giving a lot of time to it, but it was introducing them to mindfulness, and they could go do it as many times as they wanted. So of course I had to get IRB approval from UT Tyler, the School of Nursing that I was completing my dissertation, and then Texas Tech Health Science Center. I utilized a post hoc consent process as this was part of their transition course for clinical credit. So I asked after if I could use their data. So what I did was we first did the pretest. I gathered the demographic data, looked at the DASS 21, sent that out, and the coping strategy short form. We waited 2 weeks before we started the intervention. So then 2 weeks later, we started the intervention, and they did that for 4 consecutive weeks. So after the 4 consecutive weeks, we took off 2 more weeks, and then we did the post-test. The post-test was those open-ended questions, and then the 2 scales that I went over. So what did we find? We found that the DASS 21 is very reliable. It's a very good tool, and you can see the numbers there. We also found that the coping strategy short form is not a very reliable tool. So it's probably not a tool that I would use in the future. But sometimes in research, you find the things out the hard way. So you can see that the 2 scores that brought this down were the disengagement. So the problem-focused disengagement and the emotional-focused disengagement. But this kind of trickles into the results as well. So results for depression. Did their depression levels decrease? I did a simple t-test. So time 1 will tell you the range of what they answered on the pretest. Time 2 is the post-test. So they answered, you remember, the lower the number on these, the better. Statistically significant would be 0.05, and depression was not. So it was not statistically significant. Then I looked at anxiety. You can see I might have a bigger smile on my face. Anxiety was statistically significant. You can see the scores. The highest score was a 19 on the first test, and on the post-test, it all dropped to a 13. So the mindfulness module was statistically significant when it came to anxiety at a 0.018. Again with stress. So did it decrease their stress? According to this, in a simple t-test, it did at 0.005. The range went from 0 to 19 to 0 to 17 on the post-test. So that was something that really I was happy about. Then we looked at engagement and the coping and how they coped. You can see here that problem-focused engagement has a statistically significant result. So they're maybe engaged in their coping of the problem. So they have coping abilities, and they're able to take those forward when the mindfulness module was put into place, but overall, it was not statistically significant. And again, with disengagement, it just got a little bit worse. So the results there is it was not statistically significant with the coping abilities. So then I added those 2 questions to the end, asking how they perceived it. Was it a good experience, a bad experience? And I asked if they practiced mindfulness outside the module. 56 said yes, and 20 said no. So if you remember earlier, only 43%. So now I'm well over that 43%. Just by telling them about mindfulness, more of them were utilizing it. So that was something that really made me happy, is even if, I didn't get any statistically significant results, knowing that I could teach them about mindfulness, that maybe it's something that they can use to cope in the future. A lot of them said in the open-ended questions, it was very beneficial, it was worth their time, and they wish they had to do the modules every single semester. So I was like, wow, starting in level 1, they would want to do this and have it part of coursework because it helped them that much. So in my discussion, I also just want to discuss that I had a few say they used it in the clinical learning environment, and it really decreased their stress. So they would utilize it before going and taking care of a patient, or when they were overwhelmed. They were able to take their time. As we need to teach our nurses, sometimes you have to back up at the bedside, maybe take your minute of mindfulness or your breathing and be able to get yourself under control before moving forward. So that was something that I was like, wow, in the future, maybe we need to look at doing this before OSCEs, before we put them in that. Give them 2 minutes of doing mindfulness and see, do they perform better? So that's something that I was really excited about, because it was not just one student, it was multiple students that reported that it helped in the clinical setting. And then one in particular said it helped with panic attacks. So she would have panic attacks before she went to the hospital. She would sit in her car and practice mindfulness before she went in, and she said it was helpful. So I can take it for what it is, but it was something that I felt was beneficial. So we know that this 4-week online mindfulness program decreases stress and anxiety. Students believe that the exercise contributed to this, and all students should have to practice it. And then again, it doesn't cost anything, and you can manage it at your own time. So I think that's what students also liked, is it wasn't Tuesday at 10 o'clock, you have to have this in. They could manage it throughout the week and practice it when they needed to. So some strengths of the study is we now know that an online mindfulness module, 4 weeks, can help decrease stress and anxiety in nursing students. It supports previous research of mindfulness overall helping. And this study was across 3 different campuses, so it had a diversity of students. Limitation was the threats to internal validity, the history and time. Did I wait too long in between? Things that I might not ever know. And then the coping strategy inventory short form, the construct validity, was a major limitation of this study, as well as the use of a convenient sample. So recommendations is I would like to recommend that we implement mindfulness modules in our nursing curriculum. Let's see if they assist our students, especially with their health, mental illness, things that they're going through. Also look at a longitudinal study looking at the relationship of an online mindfulness intervention and the retention rate of nursing students. Possibly reviewing the effects of an online program, like I mentioned, in the clinical setting could be a next step. Take it to the clinical setting and see if it does help, or a mixed methods design. So in conclusion, a 4-week online mindfulness program supports decreased anxiety and stress. Students reported mindfulness as beneficial, very beneficial to them and worth their time. And it decreased stress in the clinical settings, and it also helped reduce panic attacks. Do y'all have questions?
Of those 43% that you mentioned had already practiced mindfulness before you instituted the questionnaire or the modules, what were they doing? I mean, what was it? Was it just a breathing app, or what? I'm just kind of curious what they were doing before you gave them the modules to do better.
The only question that it asked was do you? So I honestly don't know, unless I went back and asked. Now after the study was completed, I asked just the group of students when I went in to do my post-hoc consent. I already had all my data, so everything was already done. I did ask, what do you suggest? Because Tao is something that we do. So I said, what do you do that helps you? A lot of them said yoga. Okay, I get that. A lot of them said the Breathe app on there, so they actually utilize that. And then there's a lot of free apps. So if you go to the App Store and just Google free mindfulness, and they were pulling them up right and left on their phone to show me free apps that they use, which was really like, I learned from them, wow, I need to download these apps for myself. So one of our professors at Tech, she actually showed me one that she utilizes, and it's every day it pops up with your mindfulness at a certain time. Now is your mindfulness study, and she does it for 3 minutes a day. So there's a lot of free apps too that we can utilize without it being an online program like that. Very good.
I may have missed this, so forgive me if I did, but on the depression, did you have, were they able to tell you whether or not they had reported depression beforehand? Did you know that level before?
Before on the pretest?
Well, right. I mean, not just but like a history of depression. I would think that would maybe maybe impacted your results.
Yes, on depression, because they might have a history of depression and it just
wasn't
not helping them.
Yeah, and so that may have been more because you didn't find significance there. But if that was a strong, strong history there, I just wondered if
something we could have added to the demographic just to ask about depression before.
Just curious about that. And then one other question. This is just my curiosity here on the second scale that you had, like in the 60s and 70s on your validity. Is there a better scale, or this is just what we have right now? Because that's not terrible. It's just not what you'd hope for.
Right. I actually, after my study, found the brief cope scale, and it's only, I want to say 4 to 7 questions, and it is something, it has good, and it's something that I will utilize moving forward instead of the coping strategy inventory. And it had, in some of the studies, had better results than mine did, and it could just be my data, but.
Well, it's such a complex construct too, how people interpret it and what all of that, so.
And something that got me was, on one scale, the lower the number was better. The other scale, the higher the number was better. So did the student understand that when they were taking it? Because it was all in a row. So if as a student you were just going along and missed the...
That's a great point. Yeah.
The higher the number, the better, maybe they were going with. Does that make sense? So that's something that I also, after the fact, I was like, that could be why that scale didn't, and it was second perform as well as the depression and anxiety scale.
I think this is so exciting because it's so pervasive, and for it to be free and with such a low dose. I mean, this is a relatively manageable thing. I mean, 12 minutes for 4 weeks, and that you found that, and it's such a need. I think this is incredibly exciting as a tool that teachers can use, that we can use for students and in our own lives. It's a great job.
So something else it was yesterday, I was reading a quote. I always read the Mindfulness Wednesday or Wellness Wednesday, and people put out quotes, and Coach Wells at Tech said something like, if you're physically tough, or to be physically tough, you have to be mentally tough. So how many of us in the room can say we're 100% mentally tough all the time? Probably none of us, right? So it's not just our students. It's we have to find ways to be mentally tough and take care of our mental health as well. So mindfulness is something that I practice personally. It helps me, especially in times where, before I'm coming in here, even if it's just doing my deep breathing or practicing on an app. It helps you be in that moment and be mentally prepared for what you're going to do. So as nurses, can we keep nurses at the bedside if they have that ability to be mentally tough? Because nursing is hard. Bedside nursing, right? Education. We know it's not a walk in the park. We see, what we do every day. So being mentally tough is something goal. Let's move forward.
Really good stuff you've done here.
Well, thank you so much. I appreciate it.
Other
Gibson?
questions?
Other questions or comments?
We're all ready to sign up for
We're
class,
we're just so proud of you.
Oh,
And
thank
this is a
you.
great study.
It really
I
is.
think one of the things that people think of when they're working on a dissertation is I have to have a study that's going to solve all the world's problems.
Yes.
And the thing is, what we really need is little bites.
Mm-hmm.
And we need to see what's happening and how can we help this piece.
Right,
Because altogether it makes a big deal.
right.
So great
Well,
job.
thank you. That makes me go, thank you. Yay. Okay, doctor.
Okay. We are so proud of you. I am just thrilled and honored to return the favor. Hollis, Dr. Franco was my invited response last year, so I'm very honored to be here and just watch in awe. And we work very closely together. So Dr. Franco is the level 2, semester 2 lead, and I'm level 1 lead. So we talk 5 times a day sometimes, and we get to do life together and work together. And our end goal for all of this is ultimately resilience. And so we're both very passionate about that. And so our studies have kind of springboarded us to be able to look into that more, and especially on the faculty side. You mentioned how important you feel like it is for us or at the bedside to be have coping strategies and ultimately be resilient. So we are in the process of looking at burnout. Last January, before the pandemic, we were going to look at joy in nursing and how to cultivate joy, and then the pandemic hit. So then it turned out, it turned into burnout. So we're looking at that, which is very, very interesting. And so I'm really excited about hopefully with your new role and how you can get this implemented in nursing curriculum. And with COVID, we see an increase of all these things: stress and anxiety, self-isolation. And so this online program is definitely something that I think we can adapt for our students. So do you feel like you would get the same results in first-year nursing students?
I think so, especially with this online mindfulness program. It may help them start in the first semester and be able to take those coping strategies throughout nursing school. So now I know that hopefully they took those into the setting in the workforce and are able to stay at the bedside or know that they have this as a coping strategy. But if we started in level 1 or that first semester when times are tough, would they have that in level 2, level 3, level 4 to help them? So I know that we had good results in 4th semester, so that's something that maybe we can do soon.
I know you'll make it happen.
Another study.
Okay, and so we, and I loved how that student in clinical said that it really helped her. And so I do think that it translates into bedside practice and is something that practicing institutions can adopt as well. So Dr. Franco and I just want to leave you guys with thinking about, what are some self-care things that you do to cope, or maybe it is mindfulness, but to be thinking about, to yourself, what are the things that you do? Because as a nurse, in times like these, that's, very important. So mindfulness is certainly something that we can utilize. So thank you, Dr.
Yes,
Franco.
Thank you, and thank you for being here with me. Thank you. You're done.
Questions for Dr. Gibson or comments?
I just have a comment. A student today presented at her capstone, her theory was the ripple effect. Like a pebble in the water ripples out. And with what you're doing with students, I could see a ripple effect to
Yeah.
fellow students. They could help a fellow student that was having some severe anxiety or depression. I know that wasn't part of your study,
Right.
but the sharing of this has helped me, and maybe it would help you. But another area is faculty helping students,
Right.
because when you're around someone who's anxious, it's contagious. And so if the faculty could be mindful and calm and role model that, it could help the students. But also think about our patients. When we have these bedside nurses and they go in calm, think about what the patient is going through and they're anxious. So to me, what you're doing could have such a ripple effect among so many different faculty, students, our patients. So I just think it's phenomenal, and absolutely it is so needed. I was sharing with you before we started our graduate student that looked at the impact of COVID at the college level student, which is exactly what your intervention has been with. So it's so important right now. And as we come out of this pandemic and recover, so helping people cope that have gone through horrible experiences through the pandemic, not just our student nurses, but others as well. So it's just so appropriate and pertinent. Thank you very much.
Well, thank you. Thank you for that. And I agree, it's something that we can all help each other with, especially in these times. And I didn't know that COVID was going to hit right after, I did the intervention. But knowing that, we've been online for how long and we know how online works now, how this could help. So, thank you.
Any other comments? Let's give them another round of applause.
Thank you.